How did you go from practicing being a physical therapist to then deciding to open up your own business? What was the motivation there?
Recognizing that, of course, with any business owner, entrepreneur, this can be done better. Right. There's often a sense of like this can be done better. And, the roadblocks that you would hit trying to change things within a system, it's easier to change. It's easier to start something brand new than it is to change something that's already established. And when you're in a career, sometimes you learn that the hard way. And so then do you want to start up your own thing and take that step, or what do you do from there once you realize that of all the walls that you keep hitting when you're trying to change something and it doesn't want to change?
What type of walls were you hitting?
Oh, I mean, large healthcare systems don't want to be changed. They can change through example. They can change through market forces. They can, of course, government can come in and change things for better or for worse or whatever it might be. But I think the most powerful, or what we have most control over, are market forces and then examples.
Right. That makes perfect sense, actually. If a large institution sees some group having massive success with a new model, they will end up replicating it.
Absolutely. Or you see success, like if you see other business owners and like, wait a minute, this can be done.
Yeah.
You see someone like you doing what you want to do, but didn't think was possible. Then that empowers you to think, well, maybe we can do this. Or let's say you have a business that people don't know about. And then, wait a minute, that's already being done. I can work for a company like that.
Yes.
I can actually practice medicine in this style, in this fashion, the way that I want to, the reason I went to physical therapy school, or I went into medicine. This is the reason I became a physician or a physician assistant, whatever. This is why I went into medicine. And can I work in an environment that promotes that? Which is really almost why most healthcare providers go into healthcare. It's to serve their patients and serve their clients, to help people feel better. It's not to become a cog in a wheel. It's not to become a bureaucrat. It's not to just check boxes and fill out red tape, which is what healthcare in the traditional model has become. And so a lot of healthcare providers are trying to find ways out from that. That's often the biggest pain point for a lot of healthcare providers. How do we actually do what we want to be able to do this career that we dedicated so much time and energy and money and everything else to do? And now we find ourselves just being shoved into a work environment where we're just considered basically a bureaucrat, a cog in the wheel.
Right.
And we're kind of stuck.